Okay, let's talk about Medicare. If you're facing this decision for the first time, or maybe you're helping a loved one, you know exactly how complicated it can feel. The mailbox is suddenly overflowing, those TV commercials seem to be on 24/7, and everybody has an opinion. But listen, it really doesn't have to be that stressful. In this explainer, we're going to cut right through all that noise. We'll give you a clear, step-by-step guide so you can feel truly confident making the right choice for your health and for your budget. All right, let's dive in.
And if you are feeling a little bit overwhelmed, you are definitely not alone. It's a totally normal reaction. I mean, you're being asked to make this huge decision about your healthcare, and it feels like you have to learn a whole new language to do it. But the good news is, turning that confusion into clarity, well, it's a lot simpler than you might think. By the time we're done here, you'll have the tools you need to handle this with real confidence. So here's how we're going to do it, broken down into 5 simple parts. First, we have to tackle that famous alphabet soup of Medicare, the A, B, C, and D. Then we'll focus on your very first and most important choice. After that, we'll talk about 2 of the biggest traps that can end up costing you a lot of money and stress. Fourth, we'll cover why Medicare is not a set it and forget it kind of thing. And finally, and this is so important, we'll show you exactly where to get free, unbiased help so you never have to feel like you're doing this all on your own.
So let's start right at the beginning. Before you can even think about comparing plans, you've got to understand the basic building blocks. Once you know your A's from your B's and your C's from your D's, every other decision you have to make becomes so much clearer. Okay, let's start with Part A. Just think. A is for hospital. This is the part of Medicare that helps pay for your care if you're actually admitted to a hospital or need to go to a skilled nursing facility for a while after a hospital stay. Now, for most of us, pretty much anyone who's worked and paid Medicare taxes for about 10 years, Part A is premium free. You've been paying into this your whole working life, so think of it as the foundation of your coverage. Right, so if Part A is the hospital, Part B is basically for the doctor. This is your medical insurance. It covers all the other stuff, your regular doctor's appointments, visits to specialists, lab tests, x-rays, medical equipment you might need, and all those important preventative screenings. Now, unlike Part A, almost everyone pays a monthly premium for Part B, and it's usually just taken right out of your Social Security check. And D, well, D is for drugs. This one's pretty simple, but it's really important to know that Original Medicare, so Parts A and B together, it doesn't cover most of the medicines you pick up from the pharmacy. So if you want coverage for your prescriptions, you need to sign up for a separate private Part D plan. Now, it is technically optional, but as we're going to see in just a bit, skipping it when you're first eligible can be a really expensive mistake. And that brings us to Part C. Now, the easiest way to think about Part C, or as you'll hear it called Medicare Advantage, isn't as just another piece of the puzzle. It's more like a completely different path. These are all-in-one plans from private insurance companies. They bundle everything together for you. Your Part A hospital, your Part B medical, and usually your Part D drug coverage, all into one single package. And deciding which of these 2 paths to take, that's your first big choice. And that brings us right here. This is the big one. This is the most fundamental decision you're going to make on your whole Medicare journey. It's not just about picking a plan. It's about choosing the whole system you'll use for your healthcare. Are you going to go with the traditional government-run Original Medicare, or will you choose a privately run Medicare Advantage plan? Let's really break down what that choice means. Okay, so it really boils down to this one major trade-off. With Original Medicare, the huge benefit is freedom of choice. You can go to any doctor, any specialist, any hospital, anywhere in the entire country, as long as they accept Medicare. You never need a referral. The trade-off is you'll probably want a separate supplemental plan to cover the gaps, plus a separate Part D plan for your drugs. On the other hand, you have Medicare Advantage, which offers convenience. Everything is bundled together, often with a really low or even a $0 premium, and they usually throw in extra perks like dental, vision, and hearing. The trade-off here? You have to use their specific network of doctors and hospitals. And here's a perfect example of how that trade-off can play out in the real world. In this family story, their dad had a Medicare Advantage plan, and he broke his hip. Well, the plan decided he was ready to leave rehab after just 2 weeks, but the rules under Original Medicare would have allowed for a much longer stay. So, by switching back to Original Medicare with a supplemental plan, he was able to get the full 100 days of rehab he actually needed. It just goes to show you, it's not just about which doctors you can see, sometimes it's about the kind of care you're able to get. Okay, now that you understand the 2 main paths, let's talk about how to walk down that path safely. Because no matter which one you choose, there are two really common and really costly mistakes that people make all the time when they first sign up. Avoiding these is absolutely crucial.
The biggest mistake, especially if you're looking at Medicare Advantage, is what I call the network trap. You see a plan with a $0 premium, and it looks fantastic, but that price is totally meaningless if your trusted doctors, your cardiologist, your specialist, your family doctor of 20 years aren't covered by that plan. So before you even look at a price tag, you have to check your doctors. First, make a list of all of them. Then you have to call each office and ask the magic question. For next year, will you accept the specific ABC Medicare Advantage plan? And only after you've confirmed that your whole team of doctors is in network should you even start to compare the costs and benefits.
The second huge trap is procrastination. See, with Medicare, you can't just sign up whenever you feel like it. You have a specific 7-month window when you first become eligible, right around your 65th birthday. If you miss signing up for Part B or Part D during that window, and you don't have other health coverage, say from a job, you could get hit with a late enrollment penalty. And this isn't a one-time thing. It's a penalty that gets added to your monthly premium forever. Let me make this real for you. This example is pulled straight from the official Medicare handbook. Mrs. Martinez waited 29 months too long to sign up for her Part D drug plan. Because of that delay, Medicare calculated a penalty. For 2025, that penalty was $10.70 added to her bill every single month. That's over $128 a year in a totally avoidable cost. And that penalty can go up every year for as long as she has coverage. So let's say you've made your choice, you've avoided the big traps, you're all set for life, right? Well, not quite. Your Medicare plan needs an annual checkup, just like you do. See, insurance companies change their contracts with doctors and pharmacies every single year. So the plan that's absolutely perfect for you this year could be a really bad fit next year. And every year, Medicare gives you a specific window of time to do this checkup. It's called the annual enrollment period. It runs from October 15th to December 7th. This is your one chance each year to review your coverage and, if you need to, switch to a new Medicare Advantage plan or a different Part D drug plan for the following year. It's so important to put these dates on your calendar. So how do you know if you need to make a change? Your plan will literally tell you. Every single fall, you're going to get a thick envelope in the mail. Inside is a document called the Annual Notice of Change. Now, I know it can be tempting to just toss this aside with a junk mail, but you have got to open it and read it. This notice clearly lists every single thing that's changing for next year. If your premium is going up, if your copays are different, and most importantly, if any of your doctors are leaving the network. This document is your roadmap for deciding whether to stay put or to shop around. I know, this is a lot of information. It's complicated, and it's totally natural to want some personal, one-on-one guidance. But the great news is you do not have to rely on a sales agent who might be trying to sell you a particular plan. There are free, expert, and completely impartial resources out there whose only job is to help you. Here are the 3 best places you can turn. First, and this might be the most valuable, is your State Health Insurance Assistance Program, or SHIP. It's a government-funded program with trained counselors right in your local community who give free and totally unbiased help. You can find them at shiphelp.org. Second, if you're comfortable online, the official Plan Finder tool at Medicare.gov is fantastic. You can type in your specific medicines, and it will compare every single plan available where you live. And finally, you can always just call the official helpline at 1-800-MEDICARE, any time of day. And you know, this really brings us to the most important point of all. This isn't about finding the best Medicare plan out there. It's about finding the one plan that is the absolute best fit for your unique health needs, your specific doctors and prescriptions, and your personal budget. The plan your best friend loves could be a terrible choice for you. This is a deeply personal decision, and it really deserves your personal attention. So we've walked through the basics, we've talked about the big choice, we've pointed out the traps to avoid, and we've shown you where to get trusted help. You are now equipped with all the key checkpoints for making a great decision. So the only question left is, what's the first question you're going to ask? Will it be, are all my doctors in the network? Or maybe, how much will my prescriptions cost on this plan? Whatever your first question is, you now have the tools to find the answer. Thanks so much for joining me.